Hi, I'm Dr. Leah and I'm the founder of Epilinks. Let's talk about hyperpigmentation. So hyperpigmentation is one of the most frustrating skin concerns to manage. And even more so when your skin is sensitive, reactive, and allergen prone. The conventional treatment approach for dark spots, uneven tone, and post-inflammatory hyperpigmentation leans very heavily on ingredients that are often very irritating, especially when you have sensitive skin. High concentration vitamin C, strong AHAs, or retinoids at very potent doses. So the result is that people with sensitive skin try to fade their dark spots, but at the end they trigger a flare and they end up with even more post-inflammatory hyperpigmentation from that flare. And they find themselves worse off than when they started. But there is a better approach. So this guide that I will talk about today covers how hyperpigmentation works, which ingredients treat it effectively without inflammatory risk, and how to build brightening routine that sensitive skin can actually tolerate. So what is hyperpigmentation and why does it happen? So hyperpigmentation is the excess production and accumulation of melanin, the pigment responsible for your skin color, in localized area of the skin. So melanin is produced by melanocytes, specialist cells located in the basal layer of the epidermis, your outer layer of the skin. Under normal conditions, melanin production is regulated and distributed evenly. In hyperpigmentation, this regulation breaks down. Let's talk about the main types of the hyperpigmentation. So there is post-inflammatory hyperpigmentation. Dark spots left behind after skin is inflamed, acne breakouts, eczema flares, psoriasis plaques, contact dermatitis, burns, or any other skin injury. It is much more pronounced and more persistent in deeper skin tones. And this is the most common type of hyperpigmentation in people with sensitive skin conditions. Every flare can lead to a potential dark spot. Melasma. So larger patches of brown or grayish-brown discoloration on the face, typically on the cheeks, forehead, upper lip, and chin. Melasma is driven by hormonal factors such as pregnancy, oral contraceptives, and also UV exposure. It's actually difficult to treat and very prone to recurrence. Then let's talk about age spots. Flat, dark spots on sun-exposed area, hands, face, shoulders, and it's caused by decades of cumulative UV exposure and resulting in melanocyte damage. So the central mechanism in all of these types is UV radiation, as you know. Hormonal signals or inflammatory cytokines trigger the enzyme, tyrosinase enzyme. It's a really regulator of melanin synthesis to overproduce melanin. The most effective hyperpigmentation treatment target that enzyme, either by inhibiting the enzyme directly or by interrupting the signaling pathway that activate that enzyme. So why sensitive skin creates a hyperpigmentation trap? Well, sensitive skin is caught in a very cruel cycle when it comes to hyperpigmentation. A condition such as eczema, rosacea, contact dermatitis causes skin inflammation. The inflammation triggers post-inflammatory hyperpigmentation. Attempts to treat that with conventional brightening ingredients cause even more irritation. So this irritation causes more inflammation, which causes more hyperpigmentation. So breaking this cycle really requires choosing brightening ingredients that do not trigger further inflammation, a category that, unfortunately, is still very hard to find, but it is there. So post-inflammatory hyperpigmentation risk in eczema and rosacea. Let's talk about eczema. Every eczema flare leaves potential for hyperpigmentation in its wake, particularly in the melanin-rich skin. The stronger the flare, the more scratching is involved because it's very itchy, the more pronounced the hyperpigmentation. This is why preventing eczema flares through allergen-aware skincare and consistent hydration, moisturization is not just about comfort. It is of pivotal importance, and it will help you prevent hyperpigmentation that accumulates over years of repeated flares. Let's talk about rosacea. Rosacea is a chronic vascular inflammation in rosacea, and it can drive hyperpigmentation, particularly in the context of sun exposure related pigmentation overlying chronically inflamed skin that you already have. Let's talk about post-procedure hyperpigmentation, such as when you have laser treatments. And also it can pose significant risk in darker skin tones. Contact dermatitis. That allergic contact reaction, once resolved, frequently leave behind a hyperpigmentation mark at the site of the reaction, particularly in skin tones with more melanin, of course. This is another reason to eliminate contact allergens systemically. Every reaction is a potential long-term dark spot. So the brightening ingredients that work without irritating sensitive skin is number one, niacinamide, vitamin B3. It's really that gentle brightener. Niacinamide brightens by inhibiting the transfer of melanin from melanocytes to the surrounding keratinocytes, disrupting the delivery of pigment to the skin surface rather than inhibiting its production. This mechanism makes it much gentler than tyrosinase inhibitors and also effective even on superficial melanin already that was deposited. At 4 to 10% concentration, niacinamide produces visible improvement in hyperpigmentation and uneven skin tone over 8 to 12 weeks. It is usually well tolerated by virtually all skin types, including rosacea and eczema skin. It's fragrance-free in its pure form, and it actually pairs really well with other brightening ingredients, such as vitamin C derivatives. Vitamin C is great. It's usually brightening without irritation. But pure ascorbic acid, L-ascorbic acid, is the most potent vitamin C form, and it has the most evidence for brightening. It has also very low pH, 2.5 to 3.5. And it's also meaning that it can provide significant irritation for sensitive skin. So when you have sensitive or sensitized skin, these stable vitamin C derivatives offer excellent brightening with a far better tolerability in a low concentration. Talk about sodium ascorbyl phosphate. It's a water-soluble, converts to active vitamin C in the skin. It's well tolerated. It's also antimicrobial, so it's really beneficial for acne-prone hyperpigmentation. Ascorbyl glucoside is gentle, stable, brightening, and very well studied for melasma. Ethyl ascorbic acid is one of the more effective derivatives. It's stable at higher pH and very good tolerability profile. Kojic acid is really great. Kojic acid is a natural compound produced by certain fungi, so mushrooms, during fermentation, including sake fermentation in Japan. It's one of the most potent natural tyrosinase inhibitors available, and it also has a strong evidence for hyperpigmentation treatment. It's usually used in concentration at 1 to 4%, no more, and it's generally well tolerated for sensitive skin types at that or lower concentrations. Azelaic acid, it's multi-purpose and sensitive skin safe. So azelaic acid is exceptional for sensitive skin because it's target hyperpigmentation, acne, rosacea, all simultaneously. It's a decarboxylic acid that inhibits tyrosinase and has documented anti-inflammatory properties. So unlike many brightening acids, it's effective at a pH actually compatible with sensitive skin, 4 to 5, and it's usually recommended for melasma and hyperpigmentation in people who cannot tolerate hydroquinone or retinoids, which are very, very, very harsh for sensitive skin. It's available over the counter at 10% and by prescription at 15 to 20%. And azelaic acid is one of the most underused brightening ingredients for sensitive skin, so look for that in your skincare. Alpha-arbutin, I love alpha-arbutin. It's gentle, it's stable, it's effective, we use it everywhere. Alpha-arbutin is a glycosylated hydroquinone derivative. It converts to hydroquinone slowly in the skin, providing brightening activity without the sensitization risk and regulatory concerns of pure hydroquinone, which is prescribed. It is very gentle, well tolerated, and it's also well evidenced for hyperpigmentation and melasma at 2 to 4% concentration, low concentration. It also pairs very well with vitamin C derivatives or niacinamide to have that multi-pathway brightening approach. Licorice root extract, use with caution. This brightening component of licorice roots, glabridine, inhibits tyrosinase and has anti-inflammatory properties. However, licorice root extract also contains fragrance active compounds and can be real harsh for some individuals with sensitive skin. So choose products where specific active is standardized and the exact concentration is specified and it is very low. What to avoid when you treat hyperpigmentation for sensitive skin, on sensitive skin? So avoid high concentration AHAs, alpha hydroxy acid, used aggressively. So avoid them in high concentrations. Glycolic acid at 10+% used daily? No. Professional strength AHA peels? No. They all cause post-inflammatory hyperpigmentation in sensitive skin. So it's opposite of what you want to have. Gentle lactic acid at 5 to 8%, used 1 to 2 times weekly, is actually much more appropriate for sensitive skin. Hydroquinone. Well, hydroquinone is the most potent topical tyrosinase inhibitor available, but it's really associated with paradoxical darkening sometimes with long-term use, typically 3+ months at 4%. It's not appropriate for sensitive skin as a long-term strategy. Short-term, under supervision of dermatologists, yes, but not long-term. Retinoids without acclimatization is very harsh. They accelerate cell turnover and can help fade hyperpigmentation over time. But irritation phase will happen with everyone. And it can cause even more inflammation. So if using retinoids for hyperpigmentation on sensitive skin, use it slow, 1 to 2 times weekly, and put it on top of another very gentle moisturizer. Citrus extracts in live-on products, so not like wash-off, but live-on. Lemon juice, lime, and other citrus extracts are frequently recommended in like do-yourself brightening recipes, but they are horrible for you. They are photosensitizing, so meaning if you go in the sun, boom, you'll get hyperpigmentation. They are very disruptive on the skin, and they contain also fragrance, that's a known allergen, limonene. So really, when you have sensitive skin, it's a no-no. Building a brightening routine for sensitive skin. So, morning, use gentle, fragrance-free cleanser. Just cleanse it. Then use niacinamide serum with 4 to 5% niacinamide. Put it on top of that serum, a moisturizer, occlusive moisturizer with ceramides. And that kind of barrier will close your face off for all the pollutants. And then mineral SPF. Preferably 30 plus, but 50 is great. And that will protect your skin against the sun and UV rays and everything else. Evening, double cleanse. You have all this gunk on your face. Just double cleanse. So you can do like oil cleanser. You can do also just gentle cleanser or gentle scrub. Then use vitamin C or use a very, very nutrient-rich serum. Then you can use kojic acid or alpha-arbutin, so like tone repair cream. Use a cream with alpha-arbutin, kojic acid. That will be really, really good to rejuvenate your skin for the night. So weekly. You can also use, like we have a gentle scrub with lactic acid and biodegradable jojoba beads. You can use it every morning and every evening to like get away and have that brightening effect and take off all the dead skin of your face. Always look for vitamin C in low concentration, kojic acid in low concentration, tone repair cream with alpha-arbutin or sepi white in low concentration, and make sure it's also free from all those allergens like citrus and high concentration anything, and alpha hydroxy acid, and gluten, and obviously celiac, if you have celiac disease. Look for those top 14 allergens as recommended by FDA that are allergens in your food. Look for that it's not also in your skincare, to make sure that when you have sensitive skin, it won't even be irritated more. That will also lead for that hyperpigmentation. If you love my content, please follow me. Please leave me a comment on what you want to hear next. And I can't wait to see you tomorrow.